Okay, so good morning, good afternoon, good evening to you wonderful audience who have joined us today. We are very grateful for you making so much time to join us for this webinar. This forum is called The Road to Equitable Vaccination for COVID-19 and Beyond. My name is John Bauer. I'm the lead for vaccine implementation for Africa at the PATH Center for Vaccine Immunization and Access. And I'm delighted to moderate today's session. We will start first by going over a few logistics. We very much want to hear from you during this conversation, so please do share your questions and comments with us by submitting them in the chat or the Q&A box at any point during this webinar. We will also have some time in the later half of this hour for the audience questions and answers. Also, please note this call is being recorded and will be distributed to those unable to attend. I see that we have participants joining from all over the world, from government representatives, community organizations and NGOs, donors, as well as private sector partners and others. Thank you all for joining us. In fact, I'd love to ask a question to all of our attendees. And the question is, our community. What is the top immunization priority for your country or community? Please do type your answers in the chat box and send your answers to all panelists and attendees. So we'll be looking forward to your answers as they come through whilst the discussions continue. Yes, so as an overview for our session today, I'll briefly introduce our panelists and then frame today's conversation. From there, we will dive into facilitated questions with each of our panelists. We are honored today to be joined by an incredible group of speakers, including Dr. Kwame Amponsa Chianu, the manager for the EPI program in Ghana and the Ministry of Health, at the Ministry of Health. We are also grateful to have Sani Wenders, who is the design and operationalization lead in the office of the COVAX facility at Gavi, the Vaccine Alliance. You're welcome, Sani. And then my colleague, Sibu Sisu, who is a South African country representative and advocacy and partnership manager for PATH in South Africa. A huge thank you to you panelists for joining us today.
Thank you very much for having us.
You're most welcome. Now, I'd like to briefly share a bit about PATH Center for Vaccine Innovation and Access. We accelerate the development and delivery of life-saving vaccines for women, children, and communities around the world who need them most. For COVID-19, we are leveraging our deep expertise and experience at every stage of the complex process of vaccine research, development, and introduction, with a priority toward equitable access to vaccines and immunization. We meet today at a historic time. 15 months after COVID was declared a pandemic, 15 vaccines have been developed and are being rolled out worldwide. More than 850 million people have received at least one dose of COVID-19, the COVID vaccine as of today. The largest coordinated and multilateral effort, COVAX, has delivered 70 million doses in 125 countries. This is a massive and impressive effort by all standards. However, 75% of doses distributed globally through all mechanisms have been in just 10 countries. A year ago, the COVAX Advanced Market Commitment was established with a goal of ensuring 92 low and middle income countries would not be left behind as vaccines became available globally. But the COVAX AMC, that's the Advanced Market Commitment, has faced funding shortfalls and challenges to supply. Earlier today, world leaders met in a global summit to support the global vaccination effort, including closing the financing gap for the COVAX advanced market commitment. Public and private partners committed over $1 billion, hundreds of millions of vaccine doses, and in-kind support to accelerate the global vaccine delivery effort and support broader efforts in research and development and expansion of manufacturing capacity. With these resources, COVAX aims to reach up to 30% of the world's population and end the acute phase of the pandemic. Today, we will examine the factors that impact equitable access to vaccines to achieve this ambitious but achievable goal, as well as some of the drivers affecting the COVID-19 immunization equity dynamics from the vantage point of different countries, regional and global perspectives. We look forward to working together as a global community to end the acute phase of the pandemic through strengthening vaccine delivery efforts through COVAX and looking beyond to reach global protection in 2022. We'll also talk about priority learnings from this pandemic experience so far that can help with the current crisis and will be important to take us for the future. And with that, I'm excited to kick off today's discussions and to learn from our panelists. So, around the topic of trying to do an untangling of the barriers to equitable access to COVID-19 vaccines. Sunny, I want to pick on you first. I'd like to start with you. Following this morning's AMC summit, can you share why the COVAX AMC is important and the significance of the commitments this morning? What are some ways that COVAX has worked as expected in advancing immunization equity globally? And what, if anything, has been surprising or requires recalibration? Please, Sunny.
Great, thank you very much, and good afternoon, good morning, good evening, depending on where you are. A pleasure to be with you this afternoon. So on your first question, and maybe just to give an update to those who did not follow the AMC summit, which was really marking the first year of the establishment of the advanced market commitment last year. So to your first question of why is that important, and I think that is very, very important because it's the funding mechanism by which we have the funds to be able to distribute and to procure the doses for the countries that we call the AMC countries. So the doses, so the countries that will be receiving donor-funded doses through COVAX. So it's a very important mechanism that allows us to engage and have our agreements with the manufacturers to secure the doses. So it's a vehicle that's extremely important for us. And we had the first year, I was about to say anniversary of that today, which also was an ask for additional funding so that we would be able to reach the funding goal that we'd set ourselves for, which is to have funding for 1.8 billion doses for AMC countries. And we're very pleased to say at the event this morning, we did achieve our goal, and we now have been able to mobilize $9.6 billion that is enough to cover those 1.8 billion doses for AMC countries. So I think it's a huge signal of global solidarity, and it's of course the vehicle by which the COVAX facility can engage in its agreements and can ensure that countries will have access to these doses. Importantly, an outcome as well of this morning or this afternoon's discussion, if you were in European time, was also that we had a number of dose sharing that was announced. So over 130 million in total to date have been announced of doses that are being donated through to the end of the year as well, which is a very important step for us to have access to early doses. So that is the result of today, if you will. But to your question of how COVAX has worked in advancing equity or immunization equity more globally, well, we've worked quite hard in the last months and in increasing access to doses, and are looking very much forward to that increasing even further in the coming months. And the results today show that we have 78 million doses that have been delivered to 125 countries worldwide. We have been able to bring doses of COVID-19 vaccines to the developing world in less than 3 months compared to the rollout vaccines in high-income countries, which is unprecedented in terms of rollout of vaccines at a global level. And we've had a number of firsts that have been established in terms of COVAX that have never been done before. So one of the examples is indemnity and liability agreement, standard model agreements for all of the AMC countries, which means they have quicker and easier access to these doses. The first ever establishment of a no-fault compensation scheme, a global vaccine allocation mechanism that helps us guide where the vaccines will be going. So all of these are achievements that have been able to be done together with all partners working very much closely over this last year. But we also can't deny that we have huge challenges in front of us and that we're faced with huge challenges today. Despite these achievements, and vaccine coverage is very inequitable, and we see that across the globe. We have many countries that are still well below the 3% of the vaccination goals in many low and middle income countries, while we see high income countries coming up to 20, some even further, 38% of their populations that are being covered by vaccines. So a very, very big gap that we need to be able to achieve. Of the challenges that we've been faced with as well that maybe had surprised us or were unforeseen is the evolution of the pandemic. It has been the disease and the evolution of the emergence of variants, as well as countries being faced with massive surges that have really rolled over them and have shifted their programs, the first and the second wave, or even the third wave of the diseases now. And that has led as well to a massive amount of supply constraints that and manufacturing challenges in scaling up of vaccines to make them available at a global level. Ensuring equitable access to all of these vaccines in terms of which countries have bilateral deals versus which ones are accessing doses through COVAX as well. And maybe also we see many countries that have secured deals that are well above their populations in terms of maybe having a higher success rate of vaccines than we had initially planned for, which means that there's a very inequitable distribution of the available doses that are out there today. So one of the things that the COVAX facility is really aiming to do currently, besides procuring the doses, is have access to dose sharing, to encourage countries to really share real time the doses that they are having, so that we can cover the base coverage level of all countries and give all countries globally access to the vaccines at the same pace. With that, thanks for that question, John, and back to you.
Thank you very much, Sani, for the elaborate information. I think it's quite exciting, the kind of commitments and the effort that is being made for there to be equitable access or availability of the vaccines globally. Now, Dr. Kwame, I would like to come to you. Ghana was privileged to be the first country, I would say, the first COVAX supported country to receive vaccine doses through this global mechanism, that's the COVAX mechanism. What was the magic wand? As Ghana got ready for the COVID-19 vaccines, what do you think were the key drivers of success, and what challenges remain as the country continues to seek doses and immunize the population? Dr. Kwame?
Thank you very much, John, for that interesting question. Yes, I should give you one major answer to your first question, the driver. I would say partnership. That was I would say that the key to it. You would recall that we received our vaccines, the very first consignment of 600,000 doses from COVAX. Apparently, that has been the major contribution so far in terms of vaccines that we have received. We've enjoyed tremendous partnership from WHO, UNICEF, World Bank, CDC, Gavi itself, PATH, GSI, USAID, Breakthrough Action, of course, which is an offshoot of USAID, the NGOs, civil society, the media, the research group, the investors. In fact, even for our, I would say that we came up with a very comprehensive national deployment and vaccination plan. And thanks to the partners, we did this together. It was not as if the Ghana Health Service and by extension, the Ministry of Health sat alone and did that plan. We did that. Every partner brought in their strength. So for example, if you look at all the components that will make deployment of vaccines possible, including finances, each of the partners brought their own strengths. So UNICEF, for example, would bring in the strength of logistics and cold chain management. Of course, communication, you would want to talk about PATH and USAID, the service delivery, all components, everybody contributed. Surveillance and data management, all the partners contributed in shaping the documents that we wrote, including the issue of waste management, you name them. All, in fact, every aspect of the plan, we had inputs from our partners, and that we think ended up giving us a very comprehensive and a very good plan for which I think attracted support. And of course, that probably did the magic for us. The second aspect will be leadership. In fact, without leadership, you cannot achieve anything. Leadership is a cause, every other thing is the event. And therefore, I would say that the political commitment across all levels, from the high level presidency up to the local, I should say local government structures, all supported. The Minister for Health, the Director General, Ghana Health Service, the Director of Public Health, everybody has been part of this drive in getting vaccines into the country. The other thing would be the existing health systems itself. In fact, we tapped from all the health system structures, right from the bottom up to the top. So right from district directors and regional directors of health service, of course, the other deputies and all that, they all supported in shaping our document. And I think that from where I sit as the manager, it is a drive, a partnership drive that actually made us achieve such a wonderful feat. I didn't even mention the issue of the regulatory authorities that also supported us in shaping our document and also making sure that we were on the right track. So John, I think basically these are the drivers. Talking about challenges, I would say that before the first consignment was even received, there were lots and lots of misinformation and disinformation across the globe. And together with partners, we tried to debunk most of the, as it were, misinformation that were peddled, especially through social media. Now we have been able to generate demand, but the supply side is a huge challenge. And of course, it goes beyond the local challenge. It's actually a global challenge. And we have actually been banking our hopes on COVAX. And of course, we're also doing a lot of bilateral interactions, but unfortunately that hasn't yielded much, a lot of fruits. And so I'll say that the demand side is a problem. We have managed to surmount the hurdle of creating the demand, the supply side, I should say. The supply side has been a problem. So we in Ghana are rather very limited. We are only limited by availability of vaccines. In fact, the pressure on the vaccines is enormous now, and bridging the gap of supply has been a very difficult challenge for us to surmount. Over.
So congratulations to Ghana. I think you have a positive problem.
Yes, that is so.
Yes, where there is enough demand and you do not have enough vaccines to
we cannot meet the demand, unfortunately.
Okay. So now we transition to civil. South Africa has played an important role as a regional COVID-19 vaccination hub for Sub-Saharan Africa. Can you share some of the challenges that regional coordination has faced as you've worked to advance equitable COVID-19 vaccine access in Africa?
Right. Thank you, John, for that for that question. There have been several challenges in terms of in terms of regional coordination of vaccines. I mean, some of them have already been mentioned by Dr. Kwame and by Sane, but the continent continues to experience these challenges. As of last week, as an example, as of last week, we had only 30 of the 55 countries. I mean, we had 30 of the 55 countries having less than 1% of their population vaccinated. So that just speaks to the challenges. And also, we had only 16 of the 55 countries in Africa that had between 1 and 5% of the vaccinations. And we had 6 countries that had not administered any vaccine at all. So that just speaks to the challenges that we have. And then as a continent, so far, Africa has acquired 53 million COVID-19 vaccine doses, and only 28 million have been administered. And even of those 28 million, a majority of the people have only received they've only received a first dose, and only about 5 million people have received a first and a second dose. Now, what are the challenges? I think the first glaring challenge is what we're going to talk about probably later in terms of the capacity for Africa to manufacture its own vaccines. I mean, currently the continent produces less than 1% of the vaccines that it needs, and that is definitely not enough. That means the continent imports about over 99% of the vaccines that are used in the continent, and only a few countries are capable of making or have capacity to manufacture have some capacity in terms of vaccine manufacturing. Then the next thing is in terms of the challenges is the health systems. Most African countries do not have strong enough healthcare systems. This essentially means that even when the vaccines become available, some countries will not be able to effectively roll them out. And we've already seen vaccines expire in their thousands in several countries in the continent. And that speaks to the strength of the healthcare systems, because there are several things that we still as a continent are working on and are working to put in place, including regulatory processes for approval of the use of COVID-19 vaccines. Some countries are not able to access the COVID-19 vaccines due to challenges associated with their national medical regulatory authorities. As an example, we've got the Johnson & Johnson Gavi COVAX vehicle that has allocated over 500 million doses, provided they are proven to be efficacious and of good safety profile to low and mid-income countries, with an additional 400 million of those doses going to African countries. But that's a challenge in terms of NRAs not being able to approve them or to follow the WHO provided vehicles or guidance in terms of approval. So that's one of the challenge. The other challenge that we have is we've got low uptake of doses in some countries, and that's associated with several factors. And I think Dr. Kwame mentioned some, which include issues around confidence in vaccines or vaccine hesitancy. There's also issues around misinformation or lack of information on adverse events following vaccinations, and also issues around the non-availability of information on how people should then report these adverse events and where they could go to seek for help. Another challenge that in terms of the coordination is that of logistics. There's a significant challenge in most African countries. So most of the time when these vehicles such as COVAX, which are great initiatives, what they do is they support the countries to get the vaccines, but as soon as the vaccines reach the country, then the countries have to ensure that these vaccines reach the people that they are supposed to reach, and they need to then ensure that there's provision in terms of issues around human resources for health, around issues around cold chain management as well, and transportation. So for some of the countries, this also becomes a challenge, and this has provided or proven to be a challenge in terms of the coordination of vaccines, and it has negatively affected the vaccine rollout on the ground in several African countries. And then coupled with that is even where the vaccines are being, where the vaccination programs are being rolled out, there's still issues around just the general coordination in terms of people. Sometimes you've got, we don't have an established systems in terms of bookings, in terms of appointments, and in terms of numbers of people that are vaccinated on those sites as well. So that sometimes means people have to go back without getting the shots that they had gone to receive. And then one of the other big challenges has been mentioned, which is the COVID-19 mutations, which provides challenges at different levels. Some of the vaccines becoming less effective. But also, I think, as we have seen now, with the mutations and the emergence of strains in other parts of the world, and Africa being reliant mostly on external partners in terms of the provision of vaccines, it means that if there is a surge in India, for example, then we'll have issues around some of the vaccines and what Africa is able to access. So those are some of the challenges, John, in terms of the rollout in a nutshell. Thank you.
Okay, thank you very much. I think we've had a wonderful overview of what the challenges look like from the global level, at the regional level, and also at the country level. Our panelists have shared their deep experiences as they participate in this huge endeavor as it rolls out. But trying to transition to some of the potential learnings and also some of the potential solutions, we all do agree that from the previous segments, we've learned a lot of lessons, and also from the experiences and immunization rollouts worldwide, a lot of lessons and a lot of experiences have been achieved. So what can be done in the immediate future to bolster access to COVID-19 vaccines and guard against future pandemics? Sibu, if I want to come back to you, 100 countries, including recently the US, have endorsed the World Trade Organization's proposal to grant a waiver for COVID tools as a mid to long-term solution for bolstering manufacturing capacity. Now, with Africa expressing interest of trying to manufacture its own, if this proposal is realized, what do you think needs to be put in place now in order for the power of these tools to be realized? Sibu?
Thank you so much, John, for that for that question, and I think it's a very timely question. Just yesterday, the African Union actually released a statement where they're emphasizing the need to scale up COVID-19 vaccine manufacturing in Africa. And I mean, that speaks to the political will. I think a few weeks ago, 2 months ago, if I'm not mistaken, in April, there was the vaccine manufacturing summit that was convened by Africa CDC and the African Union. That speaks to the will is there in terms of vaccine manufacturing. But then, if we are to realize this proposal, if we are to see Africa being able to make tools, there's several things that need to be that needs to be in place. I think the first one is what everybody's talking about, to say there is a need to increase manufacturing capacity in low-middle income countries. So I mean, South Africa and India have been driving this agenda, or this TRIPS agenda. Currently, Africa has only 5 countries that have got some capacity to manufacture vaccines, and that is South Africa, Egypt, Tunisia, and Morocco, and Senegal. And even them, they've got limited capacity in terms of what can be done. So to respond to your question, there needs to be strong partnerships between low and middle income countries and industry partners to advance technology and knowledge transfer. And there needs to be significant investments to expand manufacturing capacity, logistics, workforce, and all aspects of health systems. I mean, one of the issues that will keep propping up is that, I mean, and I've seen on the charts in the questions in terms of health systems strengthening as well. So these are some of the issues, the manufacturing capacity, but that's not just the only issue. The next issue is the logistics. Once the vaccines have been made, we need to ensure that we put in place logistics to ensure that the vaccines get to where they need to get. They need to get there with being potent. They need to get there being effective as well. And then we need to put in place an effective workforce in terms of human resources for health. We need to plan efficiently as a continent and as countries in terms of ensuring that we've got the right workforce that is needed in terms of this program. For most of the countries, if not all the countries, this is the first time that you've got a vaccination program that covers everybody, not just women and young children, but it's everybody that needs to be vaccinated. and they need to be vaccinated within a certain period of time. So currently the projections are Africa will only be able to vaccinate and reach herd immunity in 2023, and that is very different from what we are seeing in developed countries or other countries. So we need to plan more in terms of workforce planning, human resources for health. We need to ensure that our regulatory frameworks, including the African Medicines Agency, we need to ensure that countries sign into that. The approval processes for products, including COVID-19 vaccines, is seamless and it's also aligned. We need to move away from a system whereby each of the 55 states needs to make their own approvals, and even after a product has been approved in the region by other countries. So I think those are some of the things that that needs to be put in place. More than anything, we need to have systems that will serve the healthcare system even way beyond COVID-19. We need to ensure that Africa and African countries are prepared for pandemics, but more than anything, we need to ensure that our healthcare systems are resilient enough in case of diseases that we currently face and in case of possible future pandemics as well. I think the point that I'll emphasize is that of the collaboration between entities such as ourselves as part in terms of working with regional bodies such as the African Union, Africa CDC, in terms of ensuring that the frameworks that are needed, the blueprint for manufacturing, the proposed manufacturing hubs in Africa, there is a lot of coordination in terms of how that is planned and how that fits into a broader health agenda in the continent in terms of health system strengthening. So, John, I think in my view, those are some of the frameworks. Those are some of the things that we need to address if we are to realize the benefits that could come out in terms of the manufacturing capacity. Thank you.
Wow. So leveraging on coordination and our capacities, pulling them together, I think might be able to help facilitate this. Okay. So Dr. Carmen, let's come back to the country level. Now, what do you see as the biggest priorities for attention and investment to improve local immunization systems, local immunization system resilience for dealing with future outbreaks and pandemics?
Okay, so John, first of all, immunization thrives in the larger environment of health systems. And therefore, for any immunization system to be robust, you need first a very strong health system. And so that should be the foremost thing. Then, of course, it's also shaped by the external environment, which is the the macro environment. So whatever happens at the macro level affects immunization. And therefore, in my view, I would say that first is the larger microenvironment. Then secondly, within that, you would have the large health systems strengthening before you can even talk about having the platform for immunization systems. There are 5 key components of the immunization systems. So service delivery, you want to get the vaccine to the ultimate recipient. And for this, you need a workforce. And so all the components of the health workforce should also be in place. The other thing will be, of course, you need the vaccines themselves. So quality vaccines, and that is where you need a regulatory body that is strong and robust enough to make sure that whatever vaccines that are coming to the country are of high quality. Of course, vaccines are kept in a cold chain. They are special agents, and therefore you need the cold chain infrastructure as well. And then, of course, added to that will be the ancillaries, the logistics that go with them, the transport, the maintenance of it, and so on. Then, of course, once you have all these, you need the demand. You need demand creation. And so that is when social mobilization and communication also feature a lot. And for this, you need not just the demand creation, but also risk mitigation efforts in terms of risk communication. Then, of course, you set out to, as it were, control certain diseases, vaccine preventable diseases. So surveillance is also very key in that. And then, of course, you need the data that you churn out to be able to tell whether you are on the right track or not. And then finally, immunization generates a lot of waste, and therefore waste management is also very key. In an attempt to prevent one disease, you don't create more diseases by poor management of waste in terms. So if I should sum it up, I would say that first, you need a stable macro environment. It even includes the microeconomics. Then, of course, a strong health systems before you can have a good immunization system. Over.
Good. I'm quite impressed so far. I don't know what our other attendees and other co-panelists think, but I think these are quite insightful and quite revealing. And so, Sunny, coming back to you and looking at the global picture, what would the global health community need to prioritize to build on and sustain this collaborative spirit for future pandemic preparedness?
Thanks, John, for that question. I think it's a super interesting question. And before kind of jumping to what we need to do for future pandemic preparedness, I think we need to realize that we still have a long way to go within the current one. And what can we do to build on this to end the pandemic? And I think that we need to relentlessly continue our efforts, which means working with all partners on the ground at both global level, regional level, national level. We need to give access to early doses, which means we need to have a greater equity in the doses that are available. I said this before, but I don't think we can underline it enough that right now what we need to do is ensure that we have doses that can be shared and can be delivered to all countries across. I think both Sibo and Kwame have touched very much upon the necessity to ensure that there's uptake of the doses, that we have strong and resilient health systems that are able to do that. And part of that as well is a funding question. And I think there were some relations to that. And at Gavi, we're looking at and bringing to decision at our executive board in about 3 weeks' time, a funding window for COVID delivery and system strengthening support, which hopefully should be able to provide quick support to countries as well to sustain and help with the uptake of the COVID vaccines. So that is, in a sense, how do we really sustain this in terms of ending this current pandemic? But I think if we look at it a little bit broader, I think what we've really learned this time around is that it's not just words to say that no one is safe until everyone is safe. It's one world protected, and we really need to look at global solidarity in that light. And I think we've seen unprecedented collaboration, mobilization of funds, coordination, especially at a global level in terms of building on the strengths of each of the organizations and really bringing their comparative advantages together to think through how we can actually solve some of these issues. Despite that, we still have the delivery challenges and the supply challenges that we've seen as well. But I think it's important that we think about how to continue the collaboration and expanding that so that we can end this pandemic, but then start thinking about how do we quickly use that to shift towards if we are faced with another pandemic, which I am afraid to say I think we will be at some point into the future, and hopefully not in the very near future. But I think we need to learn from the current situation, and I think we're going to continue learning from that. But I think it's very important to have mechanisms for funding in place very quickly. One of the things we've realized is we need access to early funding to be able to secure the deals so that we can have access to the doses very early on. And I think that's very important. And maybe with the experience we have today with the advanced market commitment, that's a good vehicle that we can build on in the future. We've already spoken about the need to build strong and resilient health systems for monitoring and surveillance and for delivery. And we need to build upon those so that we can actually use those in terms of a future one. We need to think about how this incorporates into routine immunization at some point in time, and how that can be part of the resilient health systems that we can use for future pandemics as well. And then on the more upstream, we need to make sure that we really do have a focus and funding for research and development into the future pathogens that we might see could be developing into pandemics, so that we can really leapfrog and accelerate delivery and of therapeutics, of vaccines, and of diagnostics. So those are a few thoughts about how I think this can really be a stepping stone to think about pandemic preparedness and health security going forward, and to build on that for the future. Back to you, John, and thanks.
Thank you very much for the wonderful suggestions and lessons that you've shared with us. I think we've had some wonderful interactions between ourselves. We now want to give our audience or the attendees the time to also ask questions. Please, as we've already indicated, keep your questions coming in the chat box and we will direct them to the panel. So the first question goes to Sibu. Sibu, there's a question from the chat.
I think, John, you've frozen. Hi, John. All right, I think John is frozen, and the question is, let me just pull up the question just a second. But I think it has to do with barriers in health systems that still exist. Okay, it has to do with barriers that exist with regards to efficient vaccine deployment. So I think from the context of, I'll speak from the context of South Africa, but I'll also speak from the context of the continent in terms of barriers. I think the main one of the barriers is logistics. I'll make an example. We've had countries that have already lost thousands of doses of vaccines, or through the vaccines expiring because they could not be administered on time. So I think that's a health system issue, because it's an issue of planning around human resources for health, but also it's also an issue around logistics, just getting the vaccines from the airport to the most remote of villages and ensuring that people come in. So and there are several issues there in terms of ensuring that, I'll make an example. In some countries, like I mentioned, in most countries you've had people get the first vaccine and not receive the second dose, even in instances where the doses are available in country, because of challenges around the way the rollout has been planned. In the context of South Africa, we've had several media coverage in terms of where the queues are too long. People have to be turned back because we created more demand, and then in terms of the supply, we did not coordinate the supply or the delivery of the vaccines well. So it's a systems issue, it's a health, it's a planning, and it's a logistics. It's a logistics issue as well. And then the other thing is the other challenge is the low uptake of vaccines. I think we're still at a phase where in some areas people are saying actually this is more of a pilot, so we are not very sure, or we're not very confident if we should be taking the vaccines at all, and that includes the general public. It includes healthcare workers. The truth is, we are better off than when the vaccine rollout started. But in terms of the healthcare systems, I think those are some of the challenges. Other challenges, just to wrap up, issues around your supply chain in terms of maintaining cold chain and ensuring that the vaccines are potent. I think some countries have got issues around that, and that is mainly because the healthcare systems are not capacitated enough or strong enough to be able to hold that capacity and maintain those basic basic cold chain. And then lastly, it is the issue around regulatory frameworks. We currently, as part, we are planning to be working with Africa CDC, Africa, WHO, Afro, and out in part in terms of just rolling out some workshop with national regulatory authorities to say what are the tools that you need in terms of approvals. What are those scenarios in terms of the expedited approvals for COVID-19 vaccines? Some of the countries have not shown that they have the capacity or they understand those approval processes and those health systems issues that are going to then impact. The plan is, I think Africa CDC is planning to roll out a lot of the vaccines in the third quarter, which starts next month. But then we need countries to show that they understand what are those expedited mechanisms that they can use in terms of approving vaccines. So those are some of the country specific, but also generally Africa specific challenges in the rollout of vaccines. Thanks. Over.
Okay. Yeah, so thank you, Sibu. Dr. Kwame, this question goes to you. What help is available to government in Africa to popularize vaccine uptake? I think Sani can also comment on it, but Dr. Kwame, I would like you to give it a short first. So what help is available to governments in Africa to popularize vaccine uptake? Thanks.
Well, I don't know whether I'm qualified to answer this as from where I sit, but because this appears to be a high-level question. But if I use the example of Ghana, I would think that it is more of being transparent with the media. Ghana has a very, very vibrant media. And one of the issues around COVID vaccines, especially, is being transparent. So transparency is one. I don't know what help the person has in mind, but then also I mentioned the issue of the partnership. So in Ghana, for example, when we were interacting with the media before the rollout of the vaccines, we also had a lot of support from the NGOs, especially those who are in academia, and then also those who are in the research institutions. So they all supported government in a way. So I'll say that in Ghana, for example, the partners, not just development partners, but partners in immunization, partners in health, also supported the government in terms of making vaccine, creating the demand, and of course, debunking quite a number of the rumors. You know, we have an adage that says that sometimes the government sector is not trusted. And so when you have anything to say which you think would have to go to the public domain, and you have a partner who is prepared to support you, we leave that in terms of leaving those communication bits for the partners to do. So for example, the Ghana Health Service in this COVID vaccination exercise will not go about drumming in issues about the safety of the vaccine, even though we'll mention it. Rather, we leave it for the national regulatory authorities to do, because they have the data to back that. So generally, I would say that I would rather think that it is more of partnering with all key stakeholders. That is the key to creating demand. I think that's a question. The question is getting the public confidence in vaccine. And I think that is more of partnership. Of course, the government does its bit, the Ministry of Health does its bit, but the others are also quite helpful in terms of demand generation. That's what I would like to say.
Okay, so thank you very much. This is a follow-up question to you, Dr. Kwame. You talked about the fact that now there is more demand for the vaccine than the supply that's available. How has the country been handling vaccine hesitancy and the priority populations to vaccinate?
Okay, thank you very much. Again, you would recall that most of these issues about the conspiracy theories came through the social media. So we are using multiplicity of approaches. From experience, we as EPI or Expanded Program on Immunization has had a lot of experience in campaigns, vaccination campaigns. So even within the context of COVID, we did quite a number of vaccine campaigns, some of which even targeted adults. So the yellow fever campaign, for example, our last preventive mass vaccination campaign, yellow fever, was done somewhere in October last year. And that actually helped us in ironing out some of the issues about hesitancy and also the approaches to vaccination. So first, how did we overcome hesitancy? First of all, we did use multiple media. So we use the community information centers, we use radio stations, we use TV, the television, we used house-to-house, as it were, interactions. And then also we use, as I said, non-traditional people, like the researchers, the academia, in trying to sell the vaccines, so to speak. Then on the front of the deployment itself, we also use multiple approaches. Instead of using the traditional way of setting up centers at the facilities, that's the healthcare facilities, we also used a lot of house-to-house, as it were. We actually even use workplace vaccination. So we set up vaccination centers, sending the vaccines right to where people were working. So for example, when we agreed on the target populations that we were going to vaccinate, instead of waiting for them to get to a health center or a vaccination outreach point, some of the vaccination centers were set right at the workplace. So for example, at the judiciary, the parliament, who were all part of the target, we also went to quite a number of other workplaces. So I would say that demand generation didn't just use the traditional ones, but also the non-traditional. Then also, we had a lot of social media handles to debunk some of the stories that were flying, the untrue things that were flying around in terms of social media. And so we have a whole division of health promotion that supported this. We also use the National Commission for Civic Education, which has a mandate to engage communities. Traditionally, we don't use them, but for COVID, we use them as well. They have structures all over, from national right up to the local level. And then, of course, we also use our own local health people to help create demand. So hesitancy before the rollout of the vaccine was a bit high, but it was about 70%. By the time, about a week or so to vaccine deployment, it had reduced to approximately 20%. Now I would say that hesitancy has been on the downward trend, as suggested by some of the surveys that were carried out. Over, John.
Okay, thank you. That's quite impressive. So now, Sunny, we come to you. Now, given all these impressive efforts that countries have done, Ghana has shown that now they've been able to work on the initial concerns about hesitancy, where now more people are coming forward for the vaccine. And as a questioner from Ethiopia also says, people are coming for the second dose as they become due. But what are the expected timelines for the next COVAX dose shipment? Because it appears more and more countries are struggling with the vaccine availability in order to meet these demands. Sunny?
Thank you very much for that question. And I do want to realize, as I think everyone is aware about, that our supply schedules have shifted quite a lot from what we had initially planned with the initial allocations. I think it's been made quite publicly available that COVAX, as well as globally in many places, are faced with supply constraints, and that has hit COVAX as well, which means we had not been able to deliver against the doses that we had hoped at this point in time. However, we're very confident that with the increase in supply coming in, with new deals that we're having come on board as well, that we will really pick up again in the coming months, and that towards the end of the year we'll be able to satisfy. We have not changed our goals. We're still aiming to have a total of 2 billion doses delivered by the end of the year. So that is still the target that we have. However, we're not in a place right now where we can give each of the countries, and we understand how frustrating it is for each of the countries to not know exactly the delivery schedule of when they can expect the next doses. We share that frustration very much and would hope that we would be able to have that as well. And that rest assured that we're going to be communicating as soon as we have the reliable supply numbers and being able to be to inform countries. We understand the planning that needs to go in for countries to prepare for this as well. So we're working very hard collectively to be able to inform countries about the supply as quickly as possible. But we're aiming for Q3 and Q4 to really be picking up on the supply towards all of the COVAX countries and notably to the what we call the AMC countries as part of that. Thanks for the question, John.
Okay, great. Thanks. But then I think there was another question about whether there are any opportunities or resources available for countries to support in managing hesitancy and also popularizing the vaccines.
So I think we have, or through the delivery funding that we have as well, technical assistance is very much part of that, and vaccine hesitancy is an angle within that. So it's something that's very high on the agenda for COVAX as well, as we're realizing that vaccine hesitancy will put a brake on the vaccine uptake, and we all have a shared interest in making sure that that doesn't happen. And so I think that there is, it's definitely something that there can be an engagement on how we can engage best and learn from countries as well, and the best practices that you've already seen in some of the other programs that you see, but also encouraging learning across countries on what works. I think Kwame shared some really, really interesting examples of what works in Ghana, and I think it would be really interesting to share those experiences across all of the countries, so that we can really build off upon that as we work collectively together. Thanks.
Thank you very much for that, and I would want to follow up on what the comment you made about what Dr. Kwame said, and there's an attendee who wants to get some additional information around that. So, Dr. Kwame, of the 6 components that you mentioned, what are the highest priority apart from vaccine supply to address cold chain? Are we talking about surveillance? Are we talking about communications? So apart from vaccine supply, what are the highest priority if you are to prioritize the 6 other components? Thank you.
John, I think I mentioned 5 components. So
okay,
but it will be difficult to prioritize and say this one is highest on the agenda. But okay, so if from where I sit, I would say that communication is cross-cutting, and therefore, apart from the vaccine supply, and then obviously the logistics and cold chain, you need to get the vaccine to the final recipient. So that's a service delivery. And at every stage, you need communication. And so I would put communication on top. And of course, that's not to say that the others are not important, but for the fact that communication is cross-cutting, I'll put it as a high priority. Over.
Wow. Okay, so thank you very much. We are almost on top of our time, but I would like to hear from the 3 of you in 1 sentence each. What message would you like to leave our participants with today, and what are you taking away from today's conversation? So I'll start with Simon.
All right, thank you, John. I think for me, it's just one thing to say, to just reiterate the message that no one is safe until we're all safe, and vaccine manufacturing is essential for Africa, and we need to work on strengthening our healthcare systems to ensure that the vaccines reach the people that they're supposed to reach. Thank you.
Good. Sunny?
Great, thank you. I would agree with that. No one is safe until everyone is safe, but also that we need to work collectively together. I've heard amazing experience today across the countries, and we need to really build on that, so that once we have the vaccines available, we can be able to use them as quickly as possible. So working hand in hand and continuing to communicate is really critical. Thanks.
Great. Dr. Kwame?
Yeah, John, I still want to reiterate the philosophy of COVAX. First, we want to thank the brains behind COVAX. Had it not been for COVAX, I'm sure most countries like ours will still be struggling even more. And therefore, I want to resonate the Ubuntu philosophy of you are because we are. And therefore, as the previous speakers have said, we are all in it together. Nobody is safe until everyone is safe. And this is where we would urge that vaccine nationalism should be a thing of the past. Over, John.
All too soon, we have come to the end of our live session today. It's been a wonderful time with all the panelists and all the attendees. We are very grateful for your time with us. We hope that we'll be able to continue this conversation offline, even as this session has come to an end. The email addresses of the panelists will be available, and so people can contact them for further engagement. Thank you all for your presence and your time. We are very grateful to you. Bye-bye.
Thank you very much. Bye-bye.
Thank you. Bye.